Welcome to the Introduction to Scholarly Research video series. This is video 7, EBM Level 1, and Filters. By the end of this tutorial, students will have gained a basic understanding of evidence-based medicine, or EBM, along with an understanding of how EBM relates to literature searching. They will be able to recognize the best evidence for their questions and know the difference between EBM and arbitrary filters, and be able to apply these two types of filters to their literature searches. The first question to answer is, what is EBM, or evidence-based medicine? EBM is the use of evidence in making decisions about the care of individual patients. It's the integration of your clinical expertise, patient values, and gathered evidence. What you're going to hopefully do over the course of your career is turn that integration into a true evidence-based practice, or EBP, a process of lifelong self-directed problem-based learning. The second question to answer is, how does that apply to you as a student who is not yet interacting with patients? You can begin building your evidence-based practice by utilizing evidence-based best practices now with your classwork. Practicing now, especially in the medical scholarship course or whenever you're given the opportunity to present information to others, is the perfect chance to practice evidence-based medicine. Researching with an EBM focus will start you on the correct path. One of the main things you're going to want to remember is that you don't know everything, and you never will. The minute you start thinking you know everything about a subject is the exact time when you start closing yourself off from learning anything new. But a major part of EBM is knowing when to trust your gut. You're going to spend 4 years learning all the science and medicine you can, and then you're going to have a lifetime to actually practice what you've learned and get better at it. So with those two thoughts in mind, you need to train yourself to recognize these 5 questions. 1. What do I already know? 2. What don't I know, but now need to know? 3. Where do I go to find the information that I now need? 4. How do I evaluate that information once I find it? And 5. How do I apply this new information to my existing knowledge base? These 5 questions are applicable now and will continue to be applicable once you start rotations and begin your practice. How does this apply to scholarly work and research? When you conduct research or scholarly work, you want to find the very best evidence available for your particular question. Through this series, you learned how to formulate a PICO question, pull keywords, and create a search string. Once you've conducted your search, how do you know what type of evidence to focus on? The answer depends on your question type. If your question focuses on a therapy intervention, for example, then you would start with meta-analyses and work your way down. Each question type has its own best level of evidence. The hierarchy of evidence pyramid provides a way to visualize the levels of evidence as well as the amount of evidence available. Meta-analyses and systematic reviews are the highest level of evidence, therefore they are at the top of the pyramid, but they are also the least common because they are based on the studies below them. Moving down the pyramid, the number of studies increases, but the level of evidence decreases. Being at the bottom of the pyramid doesn't mean that it's bad evidence. It can be very good, and sometimes is exactly the level of evidence required for your question. But the further down the pyramid you go, the less rigorous the standards become and the more judgment you need to exercise when thinking about using it. This all comes together when you're ready to apply filters to your search. You can sometimes retrieve results lists that are millions of titles long. To get that number down to a reasonable amount, you need to apply some standard filters. This is where you want to remember EBM and the hierarchy pyramid. For every search, the first filters applied should be the EBM filters, those that will filter for the top of the evidence pyramid or the top level of suggested evidence for your question. Only after you've applied EBM filters can you then go ahead and apply what I call the arbitrary filters. Arbitrary filters are used to weed out results that you wouldn't or couldn't read anyway, ones that are too old or in a foreign language, for example. They are arbitrary in that you have no idea whether you will retain good, bad, relevant, irrelevant articles. They are still very useful filters, and you will use them all the time, but they do nothing to tell you whether the article will best fit your needs or not, which is why you use them second. For more information on the individual parts of the scholarly work process, you can view the complete series on the Medical Scholarship and Medical Databases LibGuides. Each tutorial will only be about 5 minutes and will give you a good overview of the entire scholarly work process. If you have any questions about any aspect of scholarly work, please do not hesitate to contact either of your health sciences librarians. Our jobs revolve around this process and we'd be happy to help you through it. Thank you.